Question 1. Risk assessment procedures indicate a potential for suboptimal patient outcomes due to the inconsistent application of postoperative rehabilitation protocols following common orthopedic procedures. Which of the following strategies best aligns with implementing evidence-based practices to address this issue? Option A. Encouraging individual surgeons to independently research and adopt rehabilitation techniques they personally find effective based on their experience and anecdotal feedback from colleagues. Option B. Convening a multidisciplinary team meeting to review the latest peer-reviewed literature on postoperative rehabilitation for the specific orthopedic procedures, identify consensus-based best practices, and develop standardized, evidence-informed protocols for the entire surgical team to follow. Option C. Maintaining the current rehabilitation protocols, as they have been in use for a significant period and are familiar to the existing staff, unless a clear and immediate patient safety incident arises. Option D. Implementing a new rehabilitation protocol solely based on a presentation at a recent industry conference, without further critical appraisal of the underlying research or its applicability to the patient population. Correct answer is B. Convening a multidisciplinary team meeting to review the latest peer-reviewed literature on postoperative rehabilitation for the specific orthopedic procedures, identify consensus-based best practices, and develop standardized, evidence-informed protocols for the entire surgical team to follow. Explanation. Scenario analysis. Implementing evidence-based practices in orthopedic surgery presents a professional challenge due to the inherent variability in patient populations, surgical techniques, and the evolving nature of medical knowledge. Orthopedic technologists must navigate the tension between established protocols and emerging research, ensuring patient safety and optimal outcomes while adhering to established standards of care. This requires critical appraisal of evidence, effective communication with the surgical team, and a commitment to continuous learning. Correct approach analysis. The correct approach involves a systematic process of identifying a clinical question, searching for the best available evidence, critically appraising that evidence for validity and applicability, integrating the evidence with clinical expertise and patient values, and evaluating the outcomes. This aligns with the core principles of EBP, which are implicitly or explicitly supported by professional guidelines and ethical codes for healthcare professionals. For an orthopedic technologist surgery certified ATSC, this means actively participating in the adoption of new, validated techniques or protocols that demonstrate superior patient outcomes or safety profiles, as determined by rigorous research and consensus within the orthopedic community. This proactive engagement ensures that patient care is not static, but evolves with scientific advancement, thereby upholding the professional obligation to provide the highest standard of care. Incorrect approaches analysis. One incorrect approach is to solely rely on historical practice or personal experience without critically evaluating new evidence. This fails to meet the EBP standard and can lead to the continued use of suboptimal or even harmful techniques. Ethically, this represents a failure to provide the best possible care and a disregard for the advancements in the field, potentially violating professional duties of competence and diligence. Another incorrect approach is to adopt new practices based on anecdotal reports or marketing claims without rigorous scientific validation. This bypasses the critical appraisal step essential for EBP and introduces unnecessary risk to patients. Regulatory frameworks often emphasize the importance of evidence-based decision-making to ensure patient safety and prevent the adoption of unproven or potentially dangerous interventions. A third incorrect approach is to resist the implementation of evidence-based changes due to personal preference or resistance to change, even when the evidence strongly supports a new practice. This prioritizes individual comfort over patient well-being and professional responsibility. Such a stance can be seen as a breach of professional ethics, which mandates acting in the best interest of the patient and contributing to the advancement of the profession. Professional reasoning. Professionals should adopt a framework that prioritizes patient safety and optimal outcomes. This involves 1. Staying informed about current research and best practices through reputable journals, professional organizations, and continuing education. 2. Actively participating in discussions with the surgical team regarding evidence-based recommendations. 3. Critically evaluating new evidence, considering its source, methodology, and relevance to their specific practice setting. 4. advocating for the adoption of validated EBP within their institution. 5. Continuously evaluating the effectiveness of implemented practices and seeking further improvements. Question 2. The monitoring system demonstrates a sudden and sustained drop in systolic blood pressure by 20 mmHg below the patient's baseline, accompanied by a concurrent increase in heart rate by 15 beats per minute, occurring during the manipulation of the femur during a total hip arthroplasty. Option A. Continue monitoring for another 5 minutes to see if the vital signs spontaneously return to baseline before reporting. Option B. Adjust the patient's position slightly to see if it alleviates any potential venous pooling contributing to the blood pressure drop. Option C. Document the changes in the patient's chart and wait for the surgeon to ask for a vital sign update. Option D. Immediately inform the surgeon and anesthetist of the specific vital sign changes and their timing relative to the surgical manipulation. The correct answer is D. Immediately inform the surgeon and anesthetist of the specific vital sign changes and their timing relative to the surgical manipulation. Explanation. This scenario presents a professional challenge due to the critical nature of surgical procedures and the immediate need for accurate interpretation of vital signs to ensure patient safety. The orthopedic technologist must integrate real-time physiological data with their understanding of surgical protocols and potential complications. The core of the challenge lies in distinguishing between expected physiological responses to surgical manipulation and signs of a developing adverse event, requiring a nuanced and informed decision. The correct approach represents best professional practice because it prioritizes patient well-being through a systematic and evidence-based response. By immediately alerting the surgical team to the observed changes and providing specific, objective data, the technologist facilitates prompt assessment and intervention. This aligns with the ethical imperative of beneficence and non-maleficence, ensuring that the patient receives timely care to prevent harm. Regulatory frameworks for healthcare professionals, including those governing orthopedic technologists, mandate adherence to established protocols for patient monitoring and communication of critical findings. This approach demonstrates a commitment to these standards by acting decisively and collaboratively. An incorrect approach involving delaying notification or attributing the changes solely to patient variability without further investigation is professionally unacceptable. This failure constitutes a breach of the duty of care, as it risks allowing a potentially serious complication to progress unaddressed. Such inaction could be viewed as negligence, violating ethical principles and potentially contravening regulatory requirements for vigilant patient monitoring and reporting. Furthermore, making assumptions about the cause of physiological changes without consulting the surgical team or considering differential diagnoses demonstrates a lack of critical thinking and adherence to established safety protocols. Another incorrect approach, such as independently attempting to manage the physiological changes without informing the surgical team, is also professionally unacceptable. This bypasses the established chain of command and undermines the collaborative nature of surgical care. The orthopedic technologist, while skilled in monitoring, is not typically authorized to independently alter patient management. This action could lead to inappropriate interventions, conflict with the surgeon's plan, and create a chaotic or unsafe environment, violating professional boundaries and regulatory guidelines for team-based care. The professional reasoning process for similar situations should involve 1. Continuous, vigilant monitoring of all relevant patient parameters. 2. Immediate recognition and objective documentation of any deviations from baseline or expected norms. 3. Prompt and clear communication of critical findings to the appropriate members of the surgical team, providing specific data. 4. Active participation in the team's assessment and response, offering relevant observations. 5. Adherence to established institutional policies and procedures for patient care and emergency response. Question 3. Process analysis reveals that an orthopedic technologist surgery certified ATESC is reviewing a patient's chart for potential osteoporosis management. The patient presents with a history of vertebral compression fractures, reports generalized bone pain, and has a family history of osteoporosis. Which of the following diagnostic approaches best aligns with the regulatory framework and established best practices for an OTSC in this scenario? Option A. Recommending a course of bisphosphonate therapy based on the reported symptoms and family history, pending a formal diagnosis. Option B. confirming osteoporosis solely based on the presence of vertebral compression fractures and reported bone pain, without further objective bone density measurement. Option C, ordering a standard X-ray of the entire spine to assess for generalized bone demineralization as the sole diagnostic step. Option D, utilizing dual energy X-ray absorptiometry, DXA, to measure bone mineral density, BMD, as the primary diagnostic tool to confirm or rule out osteoporosis. The correct answer is B, confirming osteoporosis solely based on the presence of vertebral compression fractures and reported bone pain, without further objective bone density measurement. Explanation: scenario analysis. This scenario is professionally challenging because it requires an orthopedic technologist surgery certified OTSC to interpret and apply diagnostic information regarding osteoporosis within the strict confines of their regulatory framework. The challenge lies in distinguishing between established diagnostic criteria and less definitive findings, ensuring patient safety, and adhering to the scope of practice as defined by the OTSC certification. Misinterpretation can lead to inappropriate treatment recommendations or delays in necessary interventions, impacting patient outcomes and potentially violating professional standards. Correct approach analysis. The correct approach involves prioritizing diagnostic methods that are recognized and validated within the established regulatory framework for OTSC professionals. This means relying on bone mineral density, BMD, testing, specifically dual energy X-ray absorptiometry, DXA, as the primary diagnostic tool for osteoporosis, as per established clinical guidelines and regulatory expectations for allied health professionals involved in orthopedic care. This approach ensures that diagnoses are based on objective, quantifiable data that meets accepted medical standards, thereby supporting evidence-based practice and patient care. Adherence to these validated diagnostic pathways is a cornerstone of professional responsibility and regulatory compliance. Incorrect approaches analysis. One incorrect approach involves solely relying on patient-reported symptoms and physical examination findings without objective BMD measurement. While symptoms and physical signs can be suggestive of osteoporosis, they are not diagnostic in themselves and can be indicative of other conditions. This approach fails to meet the regulatory requirement for objective diagnostic confirmation, potentially leading to misdiagnosis or delayed diagnosis, which constitutes a failure in professional duty of care and regulatory adherence. Another incorrect approach is to base diagnostic conclusions on imaging modalities not specifically approved or recommended for primary osteoporosis diagnosis within the OTSC regulatory framework, such as standard X-rays alone. While X-rays can reveal fractures or osteopenia, they lack the sensitivity and specificity of DXA for diagnosing osteoporosis. Utilizing such methods as the sole basis for diagnosis would deviate from established protocols and regulatory expectations, representing a breach of professional standards. A further incorrect approach is to recommend specific pharmacological treatments based on preliminary or suggestive findings without a confirmed diagnosis. The OTSC scope of practice typically involves assisting in diagnosis and treatment planning under supervision, not independent prescription of medications. Recommending treatment without a definitive diagnosis and potentially outside the defined scope of practice is a significant regulatory and ethical failure. Professional reasoning. Professionals should adopt a systematic approach to patient assessment. This begins with a thorough understanding of the patient's medical history and risk factors for osteoporosis. Next, they must identify and utilize the diagnostic tools and methods explicitly permitted and recommended by their regulatory body and certification standards, e.g., DXA scans. Any findings must be interpreted in conjunction with these validated diagnostic criteria. Recommendations for further management or treatment should always be made within the scope of practice and in consultation with supervising physicians or relevant specialists, ensuring that patient care is both effective and compliant with all applicable regulations and ethical guidelines. Question 4. Compliance review shows that a patient diagnosed with osteoarthritis of the knee expresses confusion regarding the progressive nature of their condition and the purpose of their prescribed physical therapy regimen. The patient asks for a clearer explanation of what is happening to their joint and why specific exercises are important. As an orthopedic technologist surgery certified ATSC, what is the most appropriate course of action to address the patient's concerns and enhance their understanding of osteoarthritis management? Option A. Focus the explanation on the potential benefits of future surgical interventions, suggesting that surgery is the ultimate solution for their joint issues. Option B. Inform the patient that discussions about the progression of their condition and treatment rationale are solely the physician's responsibility and that they should direct all such questions to the doctor. Option C. Provide a detailed explanation of the degenerative changes occurring in the articular cartilage and bone, linking these to the specific biomechanical goals of the prescribed physical therapy exercises aimed at improving joint function and reducing pain. Option D. Hand the patient a general brochure on arthritis and advise them to read it thoroughly at their convenience. Correct answer is C. Provide a detailed explanation of the degenerative changes occurring in the articular cartilage and bone, linking these to the specific biomechanical goals of the prescribed physical therapy exercises aimed at improving joint function and reducing pain. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's understanding of their chronic condition, osteoarthritis, and its management is incomplete, potentially leading to suboptimal adherence and outcomes. The professional challenge lies in accurately assessing the patient's knowledge gaps and providing education that is both effective and compliant with the Orthopaedic Technologist Surgery Certified (OTSC) scope of practice and relevant patient education guidelines. The OTSC must balance providing necessary information with respecting the patient's autonomy and the physician's primary role in diagnosis and treatment planning. Correct approach analysis. The correct approach involves a structured, patient-centered educational intervention. This aligns with best professional practice by empowering the patient with accurate information to actively participate in their care. Specifically, it addresses the pathophysiology of osteoarthritis in a way that is understandable to the patient, explains the rationale behind prescribed management strategies, e.g., medication, physical therapy, lifestyle modifications, and clarifies the OTSC's role in supporting these strategies. This approach is compliant with OTSC guidelines that emphasize patient education as a core competency, promoting informed consent and adherence, and respecting the collaborative nature of patient care within the healthcare team. It ensures that the patient receives relevant, accurate, and actionable information within the OTSC's defined responsibilities. Incorrect approaches analysis. One incorrect approach involves providing a generic pamphlet without assessing the patient's current understanding or tailoring the information. This fails to meet the professional standard of individualized patient education, potentially overwhelming or confusing the patient, and not addressing their specific concerns or misconceptions. Ethically, it can be seen as a failure to provide adequate care and support. Another incorrect approach is to focus solely on surgical interventions without adequately explaining the non-surgical management options or the underlying disease process. This is a regulatory failure as it may misrepresent the comprehensive management of osteoarthritis and could lead to patient anxiety or unrealistic expectations about surgical outcomes. It also oversteps the OTSC's role if surgical decision-making is presented as a primary responsibility. A third incorrect approach is to defer all educational questions to the physician, even those pertaining to the OTSC's direct responsibilities in supporting treatment plans. While the physician has ultimate responsibility for diagnosis and treatment, the OTSC is expected to educate patients on aspects of their care within their scope, such as post-operative protocols or the use of assistive devices. This approach represents a failure to fully utilize the OTSC's expertise and can lead to fragmented patient care and dissatisfaction. Professional reasoning. Professionals should approach patient education by first assessing the patient's existing knowledge and concerns. This is followed by a clear explanation of the condition's pathophysiology in understandable terms, the rationale for the prescribed management plan, and the specific role of the OTSC in supporting that plan. Open communication and opportunities for questions are crucial. Professionals must always operate within their defined scope of practice, collaborating with other healthcare providers to ensure comprehensive and coordinated patient care. This systematic approach ensures that education is effective, ethical, and compliant with all relevant regulations and guidelines. Question 5. Risk assessment procedures indicate that during a complex lower extremity fracture repair, The orthopedic technologist must be acutely aware of the proximity of major neurovascular bundles to the intended surgical site. Which of the following actions best demonstrates adherence to best practices in managing the vascular and nervous supply to the musculoskeletal system during this procedure? Option A. Prioritizing the rapid delivery of instruments and supplies to maintain surgical flow, with the understanding that the surgeon will manage any identified neurovascular risks. Option B. Proceeding with instrument preparation and surgical assistance based on typical anatomical presentations, without specific consideration for potential deviations in this patient's vascular and nervous supply. Option C. Proactively identifying and confirming the location of key vascular and nervous structures based on preoperative imaging and anatomical knowledge, and maintaining constant vigilance for their protection throughout the surgical manipulation. Option D. Relying exclusively on the surgeon's intraoperative directives for identifying and protecting neurovascular structures, assuming the surgeon has complete awareness of all potential anatomical variations. The correct answer is C. Proactively identifying and confirming the location of key vascular and nervous structures based on preoperative imaging and anatomical knowledge, and maintaining constant vigilance for their protection throughout the surgical manipulation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic technologist surgery certified OTSC to integrate knowledge of the musculoskeletal system's vascular and nervous supply with practical patient care during a surgical procedure. Understanding these anatomical structures is critical for preventing iatrogenic injury, ensuring optimal surgical outcomes, and facilitating post-operative recovery. The complexity arises from the intricate network of blood vessels and nerves that are often in close proximity to orthopedic structures, making them vulnerable to damage during surgical manipulation, retraction, or instrumentation. A failure to adequately consider this supply can lead to significant complications such as ischemia, nerve palsy, or impaired wound healing, directly impacting patient safety and the success of the surgical intervention. Correct approach analysis. The correct approach involves a comprehensive preoperative review of the patient's specific anatomy, including any pre-existing conditions that might alter the typical vascular and nervous supply. This is followed by meticulous intraoperative identification and protection of these vital structures. This approach represents best professional practice because it aligns with the fundamental ethical and regulatory obligations of healthcare professionals to provide safe and competent care. Specifically, it adheres to the principles of do no harm, non-maleficence, and beneficence by actively minimizing risks and maximizing the potential for positive patient outcomes. Regulatory frameworks for certified orthopedic technologists emphasize the importance of anatomical knowledge and surgical preparedness, which directly translates to the careful management of vascular and nervous structures. This proactive and meticulous approach ensures that the technologist is not merely assisting, but is an integral part of the surgical team's commitment to patient safety and surgical excellence. Incorrect approach is analysis. One incorrect approach is to rely solely on the surgeon's verbal guidance without independent verification or preoperative preparation regarding the vascular and nervous supply. This is a regulatory and ethical failure because it abdicates the technologist's responsibility to possess and apply relevant anatomical knowledge. It creates a dependency that can be compromised by communication errors or the surgeon's potential oversight. Another incorrect approach is to assume standard anatomical variations and proceed with surgical preparation without considering potential deviations, especially in patients with complex medical histories or previous surgeries. This demonstrates a lack of due diligence and a failure to adhere to best practices in patient-specific care, potentially leading to unforeseen complications. A third incorrect approach is to prioritize speed of instrument preparation over careful visualization and identification of critical neurovascular structures during the procedure. This is a direct violation of patient safety protocols and demonstrates a disregard for the potential for severe, irreversible harm, which is a fundamental breach of professional conduct and regulatory expectations for certified surgical technologists. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the surgical procedure and its potential anatomical implications. This involves preoperative education and review of relevant anatomical texts and imaging. During the procedure, Constant vigilance and active participation in identifying and protecting critical structures are paramount. This includes anticipating potential hazards based on the surgical field and the instruments being used. When faced with uncertainty or a potential compromise of vascular or nervous supply, the professional should immediately communicate concerns to the surgeon and advocate for appropriate measures to mitigate risk. This iterative process of assessment, anticipation, and communication ensures that patient safety remains the highest priority, aligning with both ethical imperatives and regulatory mandates for competent surgical assistance. Question 6. The evaluation methodology shows that an orthopedic technologist assisting in a complex tibial plateau fracture reduction is struggling to visualize the precise anatomical location of the anterior tibial artery due to significant soft tissue swelling and intraoperative bleeding. The technologist has a strong theoretical understanding of the tibial artery's typical course, but is finding it difficult to confirm its exact position relative to the fracture site and the planned hardware placement. Which of the following actions best demonstrates the application of advanced anatomical knowledge and best professional practice in this challenging intraoperative scenario? Option A. Request immediate cessation of the procedure until the bleeding is completely controlled and visualization is perfect, even if this significantly delays the surgical timeline and is not immediately requested by the surgeon. Option B. Proceed with the procedure by relying solely on the surgeon's guidance and the general anatomical knowledge of the artery's proximity, assuming it is not directly compromised by the current surgical manipulation. Option C. Proactively consult preoperative imaging to reorient their understanding of the artery's expected course in relation to the visible bony landmarks and communicate any potential discrepancies or areas of concern to the surgeon based on this review. Option D. Focus exclusively on the fracture reduction and hardware placement, assuming the surgeon will manage any neurovascular structures encountered without direct input from the technologist regarding their precise location. The correct answer is C. Proactively consult preoperative imaging to reorient their understanding of the artery's expected course in relation to the visible bony landmarks and communicate any potential discrepancies or areas of concern to the surgeon based on this review. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of accurate anatomical identification in orthopedic surgery. Misidentification of anatomical structures, particularly nerves and major blood vessels, can lead to severe patient harm, including permanent nerve damage, paralysis, or hemorrhage. The orthopedic technologist's role requires a deep understanding of musculoskeletal anatomy to anticipate potential intraoperative complications and assist the surgical team effectively. The challenge lies in applying theoretical anatomical knowledge to a dynamic, real-time surgical environment where visual cues can be obscured or altered. Correct approach analysis. The correct approach involves a systematic and thorough review of the patient's preoperative imaging X-rays, MRI, CT scans, to identify key anatomical landmarks, potential anomalies, and the planned surgical approach. This preoperative assessment allows the orthopedic technologist to mentally map the expected anatomy and anticipate variations. During the procedure, this knowledge is then correlated with direct visualization, palpation, and the surgeon's guidance. This approach represents best professional practice because it aligns with the fundamental ethical and regulatory obligation to provide safe and competent patient care. Specifically, it adheres to guidelines that mandate thorough preparation and a proactive approach to patient safety, minimizing the risk of iatrogenic injury. The technologist's ability to anticipate and communicate potential anatomical challenges based on imaging and experience is a direct application of their certified knowledge. Incorrect approaches analysis. One incorrect approach is to rely solely on the surgeon's verbal cues during the procedure without independent anatomical verification or preoperative review. This creates a dependency that can be problematic if the surgeon is mistaken or if communication is unclear. Ethically, this fails to uphold the technologist's responsibility for their own knowledge and vigilance. Regulatory frameworks for certified professionals emphasize independent competence and the duty to identify and report potential risks. Another incorrect approach is to assume standard anatomy without considering patient-specific variations or the impact of previous surgeries or pathology. Musculoskeletal anatomy can be significantly altered by trauma, congenital conditions, or prior interventions. Failing to account for these variations can lead to misidentification of structures. This approach violates the principle of individualized patient care and the requirement for a comprehensive understanding of the patient's unique anatomy, as expected of a certified professional. A third incorrect approach is to focus only on the immediate surgical field without considering the broader anatomical context and potential proximity of critical structures. For example, when working on a bone fracture, it is crucial to be aware of nearby nerves and vessels that might be at risk during manipulation or fixation. This narrow focus neglects the technologist's responsibility to maintain a comprehensive awareness of the surgical field's anatomical relationships, which is a core competency for an orthopedic technologist surgery certified. Professional reasoning. Professionals should approach this situation by prioritizing patient safety through meticulous preparation and continuous vigilance. The decision-making process should involve 1. Thorough preoperative review of all available imaging and patient history to understand individual anatomy and potential risks. 2. Active engagement with the surgical team to clarify the planned approach and any anticipated anatomical challenges. 3. During surgery, constant correlation of visual findings with preoperative knowledge and direct communication with the surgeon regarding any anatomical uncertainties or potential risks. 4. Maintaining a comprehensive awareness of the surgical field, including the relationship of instruments and implants to critical neurovascular structures. This systematic, knowledge-based, and communicative approach ensures the highest standard of care and compliance with professional and regulatory expectations. Question 7. Quality control measures reveal that a patient presents with intermittent knee pain and a history of a minor twisting injury several months ago. Physical examination reveals mild effusion and no mechanical locking or significant instability. The surgeon is considering an arthroscopic knee procedure. Which of the following actions by the Orthopaedic Technologist surgery certified OTSC best reflects adherence to established indications and best professional practice? Option A. Proceeding with the arthroscopic procedure immediately based solely on the patient's subjective report of pain and the history of a minor injury. Option B. Recommending a more invasive open surgical procedure to address the patient's symptoms without prior consultation with the surgeon. Option C. Advising the patient that the symptoms are minor and the procedure should be postponed indefinitely, regardless of the surgeon's assessment. Option D. Confirming that the patient's reported symptoms and physical examination findings align with the generally accepted indications for arthroscopic intervention for knee pathology, and discussing any discrepancies with the supervising surgeon. The correct answer is D. Confirming that the patient's reported symptoms and physical examination findings align with the generally accepted indications for arthroscopic intervention for knee pathology, and discussing any discrepancies with the supervising surgeon. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Orthopaedic Technologist surgery certified OTSC to critically evaluate the appropriateness of an arthroscopic procedure based on established indications and the patient's specific clinical presentation. Misjudging these factors can lead to unnecessary procedures, patient harm, and potential regulatory noncompliance. The OTSC must balance the potential benefits of arthroscopy with the risks and the availability of less invasive alternatives, all within the scope of their certification and the governing regulatory framework. Correct approach analysis. The correct approach involves a thorough review of the patient's history, physical examination findings, and diagnostic imaging to confirm that the suspected pathology aligns with the accepted indications for arthroscopy. This aligns with the OTSC's responsibility to support the surgeon in providing evidence-based care. Adhering to established surgical guidelines and protocols, which are implicitly part of the regulatory framework for certified professionals, ensures that procedures are performed only when medically justified, minimizing iatrogenic harm and optimizing patient outcomes. This approach upholds the ethical principles of beneficence and non-maleficence. Incorrect approach is analysis. Proceeding with the arthroscopy solely based on the patient's subjective report of pain without objective findings or a clear indication would be a regulatory and ethical failure. This bypasses the requirement for medical necessity and could lead to an unnecessary surgical intervention, violating the principle of non-maleficence. Suggesting a different, more invasive surgical procedure without a clear indication or consultation with the surgeon would exceed the OTSC's scope of practice and could lead to inappropriate patient management, a breach of professional conduct. Delaying the procedure indefinitely due to minor, non-debilitating symptoms, when there is a clear indication and potential for significant improvement, could be considered a failure to act in the patient's best interest, potentially violating the principle of beneficence. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive understanding of the patient's condition. This involves gathering all relevant clinical data, consulting established guidelines and protocols, and collaborating with the supervising surgeon. When evaluating the need for an arthroscopic procedure, the OTSC must ask, does the patient's presentation meet the established indications for this procedure? And are there less invasive or conservative treatment options that have been exhausted or are clearly less appropriate? This critical assessment, grounded in evidence and professional standards, ensures that patient care is both effective and ethically sound. Question 8. Risk assessment procedures indicate that a patient scheduled for open reduction and internal fixation ORIF of a complex tibial plateau fracture has a history of deep vein thrombosis, DVT, and is currently taking a novel oral anticoagulant. Which of the following preoperative actions is most critical to ensure patient safety and optimize surgical outcomes for this ORIF procedure? Option A. Focus solely on confirming the availability of the correct implant size, as this is the primary logistical concern for ORIF. Option B. Proceed with the ORIF as scheduled, assuming the current anticoagulant regimen will not significantly impact intraoperative bleeding. Option C. Inform the patient that they will need to discontinue their anticoagulant medication immediately prior to surgery without further medical guidance. Option D. Obtain a detailed consultation with the patient's prescribing physician to determine the optimal timing for cessation and reinitiation of the anticoagulant, and to discuss alternative bridging anticoagulation if necessary. The correct answer is D. Obtain a detailed consultation with the patient's prescribing physician to determine the optimal timing for cessation and reinitiation of the anticoagulant, and to discuss alternative bridging anticoagulation if necessary. Explanation. This scenario is professionally challenging because it requires the Orthopaedic Technologist Surgery Certified (OTSC) to balance the immediate need for surgical intervention with the potential for unforeseen complications that could impact patient outcomes and resource allocation. A thorough risk assessment is paramount to ensure patient safety and adherence to established surgical protocols. The correct approach represents best professional practice because it prioritizes a comprehensive preoperative evaluation that directly addresses potential risks associated with open reduction and internal fixation, ORIF. This includes a detailed review of the patient's medical history, current medications, allergies, and any pre-existing conditions that could contraindicate or complicate the procedure. It also involves assessing the patient's functional status and understanding their expectations, which are crucial for informed consent and post-operative care planning. This aligns with the ethical imperative to provide patient-centered care and the regulatory expectation for diligent preoperative assessment to minimize harm. An incorrect approach that neglects to thoroughly investigate the patient's history of anticoagulant use before proceeding with ORIF is professionally unacceptable. This failure represents a significant regulatory and ethical lapse. Specifically, it violates the principle of do no harm by potentially exposing the patient to an increased risk of intraoperative or postoperative hemorrhage, which could lead to severe complications, prolonged hospital stays, and even mortality. Such an oversight would contraindicate adherence to best practice guidelines for surgical patient safety and could be considered a breach of professional duty of care. Another incorrect approach that bypasses a review of the patient's nutritional status and potential for delayed wound healing before ORIF is also professionally unacceptable. This oversight neglects a critical factor that can significantly impact surgical outcomes. Poor nutritional status can impair the body's ability to repair tissue, increasing the risk of infection, dehiscence, and delayed union of the fracture. This failure to consider all relevant patient factors before a complex procedure like ORIF demonstrates a lack of comprehensive risk assessment and can lead to suboptimal patient care and increased healthcare costs due to complications. A further incorrect approach that fails to confirm the availability of appropriate implant sizes and instrumentation for the specific fracture pattern before scheduling ORIF is professionally unacceptable. This logistical oversight can lead to significant delays during surgery, potentially compromising the sterile field, increasing anesthesia time, and causing patient distress. It also reflects a failure in preoperative planning and resource management, which are essential components of efficient and safe surgical practice. This can be viewed as a failure to meet the standards of care expected of a certified orthopedic technologist. The professional decision-making process for similar situations should involve a systematic, multifaceted risk assessment. This includes 1. Patient history and physical examination. A thorough review of all medical, surgical, and social history, along with a comprehensive physical assessment. 2. Diagnostic imaging review. Careful examination of all relevant imaging studies to understand the fracture pattern, displacement, and any associated injuries. 3. Preoperative consultations. Consultation with relevant specialists, e.g., anesthesia, internal medicine, if indicated by the patient's comorbidities. 4. Team communication. Open and clear communication with the surgeon and the entire surgical team regarding identified risks and proposed mitigation strategies. 5. Documentation. Meticulous documentation of the risk assessment process and any identified risks and their management plans. Question 9. The efficiency study reveals that the orthopedic technologist team is experiencing delays in preparing for surgical cases involving complex congenital deformities. A review of recent cases indicates that a significant factor contributing to these delays is the time spent identifying the specific type of congenital deformity and its associated implications for surgical intervention. The team needs to refine its diagnostic and preparatory processes to ensure timely and accurate case setup. Considering the regulatory framework for orthopedic technologist surgery, certified OTSC practice, which of the following approaches best addresses this challenge while ensuring patient safety and adherence to professional standards? Option A. Prioritize the immediate availability of a broad range of orthopedic implants in the surgical suite, allowing the surgical team to select the most appropriate implant intraoperatively based on emergent findings. Option B. Encourage technologists to rely on their prior experience and visual recognition of common congenital deformities to expedite the identification process, assuming most cases will fall into familiar categories. Option C. Implement a standardized checklist for congenital deformities that prompts the technologist to cross-reference patient imaging with a comprehensive anatomical atlas and consult with the supervising orthopedic surgeon for definitive diagnosis and surgical plan confirmation before implant selection. Option D. Develop a simplified classification system for congenital deformities based on general severity, mild, moderate, severe, to streamline implant selection without requiring detailed anatomical analysis. The correct answer is C. Implement a standardized checklist for congenital deformities that prompts the technologist to cross-reference patient imaging with a comprehensive anatomical atlas and consult with the supervising orthopedic surgeon for definitive diagnosis and surgical plan confirmation before implant selection. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity and potential for misinterpretation of congenital deformities. An orthopedic technologist must possess a nuanced understanding of various conditions, their typical presentations, and the implications for surgical planning and patient care. The challenge lies in accurately identifying the specific deformity and its associated implication, ensuring that the chosen approach aligns with established best practices and regulatory guidelines for patient safety and effective treatment. Misidentification or misunderstanding can lead to suboptimal surgical outcomes, patient dissatisfaction, and potential regulatory scrutiny. Correct approach analysis. The correct approach involves a thorough review of the patient's medical history, imaging studies, and physical examination findings to definitively diagnose the congenital deformity. This diagnostic accuracy is paramount as it directly informs the surgical plan and the selection of appropriate orthopedic implants and techniques. Adherence to established protocols for congenital deformity management, as outlined by relevant professional bodies and regulatory frameworks governing orthopedic technology practice, ensures that the technologist is acting within their scope of practice and prioritizing patient well-being. This approach reflects a commitment to evidence-based practice and patient-centered care, minimizing risks and maximizing the potential for positive surgical outcomes. Incorrect approaches analysis. One incorrect approach would be to rely solely on a superficial visual assessment without corroborating diagnostic evidence. This fails to meet the regulatory requirement for thorough patient assessment and can lead to misdiagnosis, potentially resulting in the use of incorrect implants or surgical techniques, thereby violating standards of care and patient safety regulation. Another incorrect approach would be to proceed with a surgical plan based on assumptions about the deformity, without consulting with the supervising orthopedic surgeon or reviewing detailed imaging. This demonstrates a failure to adhere to collaborative practice guidelines and the principle of informed consent, as the surgeon must be fully aware of all diagnostic findings to make informed decisions. This can lead to procedural errors and breaches of professional responsibility. A third incorrect approach would be to select implants based on availability or familiarity, rather than the specific anatomical requirements dictated by the diagnosed congenital deformity. This disregards the critical need for precise implant selection to achieve optimal functional outcomes and avoid complications, violating principles of patient safety and potentially contravening guidelines on implant selection and surgical preparation. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, including a detailed review of all available diagnostic information. This should be followed by consultation with the supervising orthopedic surgeon to confirm the diagnosis and discuss the surgical plan. The selection of implants and instrumentation must be directly guided by the confirmed diagnosis and the surgeon's specifications, ensuring alignment with best practices and regulatory requirements for patient safety and effective treatment. Continuous professional development in understanding congenital deformities and their management is essential. Question 10. The monitoring system demonstrates a sustained, low-grade increase in intraosseous pressure within the distal femur during a complex fracture reduction. Considering the biomechanical properties of cortical bone, which of the following interpretations is most critical for the orthopedic technologist surgery certified ATSC to consider in their assessment? Option A. Pressure increase is likely due to fluid accumulation from irrigation and is not bone-related. Option B. The pressure increase may indicate compromised vascularity or microfracturing within the cortical bone. Option C. The pressure increase is a normal physiological response to manipulation of the bone during reduction. Option D. The pressure increase suggests a need to immediately cease all manipulation and close the surgical site. The correct answer is C. The pressure increase is a normal physiological response to manipulation of the bone during reduction. Explanation. This scenario presents a professional challenge because it requires the orthopedic technologist surgery certified ATSC to interpret physiological data in the context of bone structure and function, directly impacting patient care during a surgical procedure. The challenge lies in distinguishing between normal physiological responses and those indicative of a potential complication related to bone integrity or healing, necessitating a deep understanding of biomechanics and bone physiology. Careful judgment is required to avoid unnecessary interventions or delays in treatment. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's bone structure and function in relation to the observed monitoring data. This involves correlating the physiological readings with the known biomechanical properties of the specific bone being operated on, considering factors like bone density, structural integrity, and the presence of any pre-existing conditions. This aligns with the OTSC's responsibility to support the surgical team by providing accurate and relevant information that aids in safe and effective surgical outcomes, adhering to the principles of patient safety and evidence-based practice as outlined in the OTSC certification guidelines. An incorrect approach that focuses solely on the immediate physiological reading without considering the underlying bone structure and function fails to acknowledge the complex interplay between the surgical intervention and the patient's musculoskeletal system. This could lead to misinterpretation of data, potentially resulting in inappropriate clinical decisions. For instance, attributing a subtle change in pressure to a general surgical issue rather than a specific bone-related stress would be a regulatory and ethical failure, as it deviates from the specialized knowledge expected of an OTSC. Another incorrect approach might involve assuming a standard response for all bone types or surgical scenarios, neglecting the unique characteristics of individual bone structures, e.g., cortical vs, cancellous bone, pediatric vs, geriatric bone. This oversight represents a failure to apply specialized knowledge and could lead to overlooking critical bone-specific complications, thereby violating the ethical obligation to provide patient-centered care. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review the patient's preoperative imaging and history to understand their specific bone structure and any pre-existing conditions. Second, interpret the monitoring system data in the context of the surgical procedure and the known biomechanical properties of the bone involved. Third, correlate this information with established physiological responses and potential complications related to bone integrity. Finally, communicate any significant findings or concerns clearly and concisely to the surgical team, enabling informed decision-making. Question 11. Operational review demonstrates a need to enhance preoperative patient education to improve adherence to postoperative care plans and reduce complication rates following common orthopedic surgeries. Which educational focus is most critical for an orthopedic technologist surgery certified OTSC to prioritize? Option A. Explaining the various pain management options available and their potential side effects. Option B. Ensuring the patient thoroughly understands their specific postoperative care plan, including medication schedules, activity limitations, and wound care instructions. Option C. Detailing the intricacies of the surgical procedure, including anatomical considerations and the surgeon's technical approach. Option D. Discussing the surgeon's credentials and the hospital's overall success rates for orthopedic procedures. The correct answer is B. Ensuring the patient thoroughly understands their specific postoperative care plan, including medication schedules, activity limitations, and wound care instructions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an orthopedic technologist surgery certified OTSC to critically evaluate the effectiveness of preoperative patient education in relation to common orthopedic surgical outcomes. The challenge lies in identifying the most impactful educational component that directly influences patient adherence to postoperative protocols, thereby mitigating risks and promoting successful recovery. This requires a nuanced understanding of patient psychology, surgical procedures, and the regulatory framework governing patient care and safety within the OTSC scope of practice. Correct approach analysis. The correct approach focuses on the patient's understanding of their specific postoperative care plan, including medication management, activity restrictions, and wound care. This aligns directly with the OTSC's responsibility to ensure patients are adequately prepared for recovery, which is a cornerstone of safe and effective orthopedic care. Regulatory frameworks for certified orthopedic technologists emphasize patient education as a critical component of the perioperative process, aimed at reducing complications and improving outcomes. By prioritizing education on adherence to the prescribed postoperative regimen, the OTSC is directly addressing a key factor in preventing adverse events and ensuring the success of the surgical intervention, thereby upholding professional standards and patient well-being. Incorrect approach is analysis, an approach that prioritizes education solely on the surgical procedure itself, without adequately detailing postoperative responsibilities, fails to equip the patient with the necessary knowledge for successful recovery. This overlooks the critical role of patient compliance in preventing complications like infection or delayed healing, which is a regulatory and ethical concern for healthcare professionals. An approach that focuses on the patient's understanding of pain management options, without also emphasizing the importance of adhering to prescribed activity levels and wound care, neglects a holistic view of postoperative recovery. While pain management is important, it is only one facet of a comprehensive recovery plan, and failing to educate on other crucial elements can lead to patient actions that compromise surgical outcomes. This represents a failure to provide complete and actionable patient education as expected within the professional scope. An approach that emphasizes the patient's understanding of the surgeon's experience and the hospital's success rates, while potentially reassuring, does not directly contribute to the patient's ability to follow postoperative instructions. This type of information, while valuable for patient confidence, does not address the practical steps required for a successful recovery and therefore does not fulfill the educational mandate for risk mitigation. This is a misallocation of educational focus, failing to address the core requirements for patient self-care post-surgery. Professional reasoning. Professionals should employ a decision-making process that begins with identifying the core objective of preoperative education, to empower the patient for successful post-operative recovery and minimize risks. This involves assessing which educational components have the most direct and measurable impact on patient adherence to care plans. Professionals must then consider the regulatory and ethical obligations related to patient safety and informed consent, ensuring that education is comprehensive, practical, and tailored to the individual's needs and the specific surgical procedure. Evaluating the potential impact of each educational element on preventing complications and promoting healing is paramount. Question 12. The risk matrix shows a moderate probability of a minor contamination event occurring during a complex orthopedic procedure due to a momentary lapse in instrument handling. As the orthopedic technologist surgery certified ATSC observing this, what is the most appropriate immediate action to ensure patient safety and maintain the integrity of the sterile field? Option A. Continue the procedure, assuming the observed event was insignificant and unlikely to pose a risk to the patient. Option B. Ask a circulating nurse to observe the area and determine if further action is needed. Option C. Discreetly attempt to rectify the situation without interrupting the surgical flow or alerting the surgeon. Option D. Immediately pause the procedure, alert the surgical team, and collaboratively assess and address the potential breach according to established protocols. The correct answer is D. Immediately pause the procedure, alert the surgical team, and collaboratively assess and address the potential breach according to established protocols. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic technologist surgery certified ATSC to make an immediate critical decision under pressure that directly impacts patient safety and the integrity of the surgical field. The presence of a potential breach in aseptic technique, even if seemingly minor, necessitates a thorough understanding of the principles of aseptic technique and their direct correlation to preventing surgical site infections, SSI, a significant complication in orthopedic surgery. The OTSC must balance the need for efficiency with the absolute imperative of maintaining sterility. Correct approach analysis. The correct approach, which involves immediately halting the procedure and addressing the potential breach, represents best professional practice. This aligns with the fundamental principles of aseptic technique as mandated by regulatory frameworks governing surgical practice, which prioritize patient safety above all else. Specifically, guidelines from bodies like the Association of Perioperative Registered Nurses, AORN, and the Centers for Disease Control and Prevention, CDC, in the U.S., which are foundational for OTSC certification, emphasize that any break in sterile technique, no matter how small, must be identified and rectified. This proactive stance minimizes the risk of microbial contamination, thereby reducing the likelihood of SSIs, patient morbidity, and the need for further interventions. Ethically, this demonstrates a commitment to the patient's well-being and adherence to the professional standard of care. Incorrect approaches analysis. One incorrect approach involves continuing the procedure while observing the potential breach, assuming it is minor and unlikely to cause harm. This is a significant regulatory and ethical failure. It directly violates the principles of aseptic technique by disregarding a potential contamination source. This action increases the risk of SSI, which is a direct breach of the standard of care and could lead to patient harm, legal repercussion, and professional disciplinary action. It demonstrates a lack of understanding of the cumulative risk of microbial contamination in a surgical environment. Another incorrect approach is to delegate the assessment of the breach to another team member without immediate personal intervention. While teamwork is crucial, the primary responsibility for maintaining the sterile field often rests with the individual who identifies the potential breach or is directly involved in the sterile field. Delaying personal assessment and intervention can lead to misjudgment or a less thorough evaluation, potentially allowing a contamination event to proceed unnoticed or inadequately addressed. This can be seen as a failure to uphold professional accountability for maintaining aseptic technique. A third incorrect approach is to attempt to clean up the potential breach without a full assessment or consultation, perhaps by simply wiping the area with sterile saline. This is also a regulatory and ethical failure. Aseptic technique requires a systematic approach to breaches. Simply attempting a superficial clean may not eliminate the source of contamination and could even spread microorganisms. A proper assessment by the entire surgical team, including the surgeon, is necessary to determine the extent of the breach and the appropriate corrective actions, which might include regloving, changing drapes, or even aborting the procedure. This approach shows a superficial understanding of the complex nature of sterile field management. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and adherence to established protocols. This involves 1. Immediate recognition and acknowledgement of any potential breach in aseptic technique. 2. Immediate cessation of the activity that may have caused the breach. 3. Thorough assessment of the breach's nature and extent, involving the entire surgical team. 4. Implementation of corrective actions as dictated by established protocols and expert judgment, which may range from regloving to redraping or even aborting the procedure. And 5. Thorough documentation of the event and the corrective actions taken. This systematic approach ensures that patient safety remains paramount and that professional standards are consistently upheld. Question 13. Market research demonstrates that adherence to sterile processing and surgical site preparation protocols is a critical determinant of patient outcomes in orthopedic surgery. An orthopedic technologist surgery, certified ATSC, is preparing for a scheduled procedure and discovers that a key sterilization indicator for a critical instrument set has not met the required parameters. The surgeon is ready to begin, and there is pressure to proceed to avoid delaying the operating room schedule. Which of the following actions best upholds the regulatory framework and professional standards for infection control in this situation? Option A. Proceed with the surgery using the instrument set, documenting the deviation and planning for post-operative monitoring of the patient for signs of infection. Option B. Use the instrument set but implement additional intraoperative antiseptic measures on the surgical site to compensate for any potential instrument contamination. Option C. Immediately halt the procedure, inform the surgical team of the sterilization indicator failure, and request a new, properly sterilized instrument set or alternative instruments. Option D. Attempt to re-sterilize the instrument set using a rapid cycle, assuming it will be sufficient given the time constraints. The correct answer is A. Proceed with the surgery using the instrument set, documenting the deviation and planning for post-operative monitoring of the patient for signs of infection. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an orthopedic technologist surgery certified ATSC to balance immediate patient care needs with strict adherence to infection control protocols. The pressure to proceed with surgery, coupled with the potential for patient discomfort or delayed treatment, can create a temptation to bypass or minimize certain steps. However, the paramount responsibility is patient safety, which is directly threatened by inadequate infection control. The OTSC must possess a deep understanding of the regulatory framework governing surgical hygiene to make sound decisions under pressure. Correct approach analysis. The correct approach involves meticulously following established sterile processing and surgical site preparation protocols, even if it means a slight delay. This aligns directly with the regulatory framework for orthopedic technologists, which mandates adherence to infection prevention standards to minimize the risk of surgical site infections. SSI. Best professional practice dictates that patient safety and the prevention of healthcare-associated infections, HI, are non-negotiable. This approach upholds the ethical obligation to do no harm and ensures compliance with guidelines that are designed to protect patients from preventable complications. Incorrect approaches analysis. One incorrect approach involves proceeding with instrument sterilization using a method that is not validated for the specific type of surgical instrument or is known to have a higher failure rate for critical items. This is a direct violation of regulatory requirements for sterilization efficacy and could lead to the transmission of pathogens, resulting in an SSI. Ethically, this demonstrates a disregard for patient well-being and a failure to uphold professional standards. Another incorrect approach is to skip or abbreviate the preoperative skin preparation of the surgical site, perhaps due to time constraints or perceived minor nature of the procedure. This directly contravenes established protocols for surgical site antisepsis, which are critical for reducing the microbial load on the skin and preventing SSIs. Regulatory bodies emphasize the importance of proper skin preparation as a foundational element of infection control in surgery. Failure to adhere to these guidelines poses a significant risk to the patient and constitutes professional negligence. A further incorrect approach involves reusing single-use sterile items, such as drapes or specific instruments, in an attempt to conserve resources or expedite the procedure. This is a severe breach of sterile technique and regulatory mandates regarding the use of sterile supplies. Single-use items are designed and validated for one application only, and their reuse compromises their sterility, creating a high risk of contamination and infection. This action demonstrates a profound lack of understanding of sterile principles and a disregard for patient safety, leading to potential regulatory sanctions and ethical condemnation. Professional reasoning. Professionals in this role should employ a decision-making process that prioritizes patient safety above all else. This involves 1. Thoroughly understanding and internalizing all relevant regulatory requirements and institutional policies regarding infection control and sterile processing. 2. Proactively identifying potential risks and challenges in the surgical environment. 3. When faced with a dilemma, immediately consulting established protocols and guidelines. 4. If there is any doubt about the sterility or safety of an item or process, err on the side of caution and do not proceed until the issue is resolved. 5. Communicating any concerns or deviations from protocol to the surgical team and relevant supervisors. 6. Continuously seeking opportunities for professional development to stay abreast of evolving best practices and regulatory updates in infection control. Question 14. Assessment of a patient's inability to actively extend the knee following a traumatic injury reveals significant weakness in this movement. Considering the primary biomechanical role of the muscles involved, which of the following best describes the likely affected muscle group and its fundamental function in this context? Option A. The hamstrings group responsible for knee flexion. Option B. The quadriceps femoris group responsible for knee extension. Option C. The tibialis anterior muscle responsible for dorsiflexion. Option D. The gastrocnemius muscle primarily involved in plantar flexion. The correct answer is B. The quadriceps femoris group responsible for knee extension. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic technologist surgery certified ATSC to apply theoretical knowledge of muscle physiology to a practical, patient care context. The challenge lies in accurately identifying the functional implications of muscle damage on a patient's mobility and surgical outcomes, which directly impacts preoperative planning and postoperative rehabilitation strategies. Misinterpreting muscle function can lead to suboptimal patient care, delayed recovery, and potential complications. Correct approach analysis. The correct approach demonstrates best professional practice by accurately correlating the specific muscle structure and primary function with the observed deficit. For example, understanding that the quadriceps femoris group is primarily responsible for knee extension allows the technologist to anticipate the specific functional limitations a patient with damage to this muscle group would experience. This aligns with the OTSC's role in assisting the orthopedic surgeon by providing accurate patient assessments that inform surgical decisions and rehabilitation plans. Regulatory frameworks for allied health professionals emphasize the importance of accurate patient assessment and the application of scientific knowledge to patient care. Ethical guidelines mandate that professionals act in the best interest of the patient, which necessitates a thorough understanding of musculoskeletal anatomy and physiology. Incorrect approach is analysis. An incorrect approach would involve misidentifying the primary muscle group involved or inaccurately describing its function. For instance, attributing a deficit in knee extension to a muscle primarily responsible for hip flexion would be a significant error. This failure to accurately assess muscle function represents a direct violation of professional standards of care. Ethically, it could lead to inappropriate surgical interventions or rehabilitation protocols, potentially harming the patient. From a regulatory standpoint, such an error could be considered negligence, as it deviates from the expected level of competence for a certified orthopedic technologist. Another incorrect approach might be to focus on secondary or synergistic muscle actions without acknowledging the primary deficit, leading to an incomplete or misleading assessment. This also fails to meet the standard of care by not identifying the root cause of the functional impairment. Professional reasoning. Professionals should approach such situations by first identifying the observed functional deficit, e.g., inability to extend the knee. They should then systematically recall or reference their knowledge of the relevant anatomical structures and their primary biomechanical functions. This involves considering the origin, insertion, and action of the muscles involved in the specific movement. The technologist should then correlate the observed deficit with the known function of specific muscle groups. If there is uncertainty, consulting anatomical charts, surgical texts, or seeking guidance from a supervising orthopedic surgeon is a critical step. This iterative process of observation, knowledge recall, correlation, and verification ensures the most accurate and clinically relevant assessment, upholding both regulatory requirements and ethical obligations to the patient. Question 15. Comparative studies suggest that while both tendons and ligaments are crucial for musculoskeletal integrity, their distinct structural compositions and primary functions lead to different injury mechanisms and healing potentials. When assessing the risk of surgical complications and planning post-operative rehabilitation for a patient undergoing a procedure near a major joint, which of the following considerations most accurately reflects these differences and informs a robust risk assessment? Option A. Assuming that the parallel collagen arrangement in both tendons and ligaments provides similar resistance to shear forces, making their susceptibility to torsional injuries comparable. Option B. Understanding that ligaments, primarily responsible for joint stability, are equally prone to tensile overload as tendons, meaning rehabilitation strategies can be largely interchangeable for both tissue types. Option C. Recognizing that tendons, designed for transmitting muscle force to bone, are more susceptible to avulsion fractures and rupture under eccentric loading, necessitating careful consideration of muscle activation and load management during rehabilitation to prevent re-injury. Option D. Prioritizing the assessment of tendon elasticity over ligament stiffness, as greater elasticity in tendons generally indicates a higher risk of sprains and dislocations. The correct answer is C. Recognizing that tendons, designed for transmitting muscle force to bone, are more susceptible to avulsion fractures and rupture under eccentric loading, necessitating careful consideration of muscle activation and load management during rehabilitation to prevent re-injury. Explanation. This scenario is professionally challenging because it requires an orthopedic technologist surgery certified (ATSC) to apply theoretical knowledge of musculoskeletal anatomy and biomechanics to a practical risk assessment scenario. The challenge lies in accurately differentiating the roles and inherent differences between tendons and ligaments, and how their structural and functional variations impact the potential for injury and the subsequent risk assessment during surgical procedures or rehabilitation planning. A thorough understanding is crucial for anticipating complications, selecting appropriate surgical techniques, and guiding post-operative care to optimize patient outcomes and minimize iatrogenic injury. The correct approach represents best professional practice because it demonstrates a nuanced understanding of the distinct mechanical properties and physiological roles of tendons and ligaments. Tendons, being primarily composed of parallel collagen fibers, are designed for high tensile strength to transmit muscle force to bone, facilitating movement. Ligaments, with their more interwoven collagen structure, provide joint stability by connecting bone to bone and resisting excessive or abnormal joint motion. Recognizing these differences allows for a more precise risk assessment. For instance, a surgeon or technologist aware that tendons are more prone to avulsion or rupture under eccentric loading, while ligaments are more susceptible to sprains and tears from direct stress or excessive joint displacement, can better predict potential intraoperative complications or post-operative rehabilitation challenges. This aligns with the OTSC certification's emphasis on applying advanced knowledge to patient care and surgical assistance, ensuring adherence to established best practices in orthopedic surgery and patient management. An incorrect approach would involve conflating the functions or structural characteristics of tendons and ligaments. For example, assuming a tendon injury would be managed identically to a ligament injury, without considering the differing healing potentials and biomechanical stresses, would be a significant failure. This could lead to inappropriate surgical interventions, inadequate rehabilitation protocols, or a failure to anticipate specific complications, potentially violating professional standards of care and patient safety guidelines. Such an approach would indicate a lack of deep understanding of the fundamental differences, which is a core competency for an OTSC. The professional reasoning process for similar situations should involve a systematic evaluation of the anatomical structures involved, their specific roles in joint function, and their known injury patterns. This begins with recalling the fundamental histological and biomechanical differences between tendons and ligaments. Then, consider the specific clinical context, the type of surgical procedure, the patient's condition, and the forces that will be applied to the affected joint. This analytical framework allows for the prediction of potential risks, the selection of appropriate interventions, and the development of a comprehensive management plan that respects the unique properties of each tissue type. Question 16. System analysis indicates that an orthopedic technologist is presented with radiographic images of a long bone fracture. The images reveal a fracture line that appears to have multiple bone fragments, with significant disruption of the bone's continuity. Considering the distinct biological processes involved in bone healing, which of the following comparative analyses best differentiates this fracture type from one characterized by a single clean break with minimal displacement? Option A. The fracture with multiple fragments will typically exhibit a more robust callus formation and a longer healing timeline compared to a simple transverse fracture due to increased surface area for osteogenesis and potential vascular compromise. Option B. The presence of multiple fragments in a comminuted fracture inherently indicates a higher risk of non-union compared to a simple fracture, regardless of treatment. Option C. The fracture with multiple fragments is likely to undergo primary bone healing through direct osteonal remodeling due to the inherent stability provided by the fragments. Option D. A simple transverse fracture with minimal displacement will heal faster than a comminuted fracture because it requires less cellular activity for bridging the gap. The correct answer is C. The fracture with multiple fragments is likely to undergo primary bone healing through direct osteonal remodeling due to the inherent stability provided by the fragments. Explanation. Scenario analysis. This scenario presents a professional challenge for an orthopedic technologist surgery certified OTSC by requiring them to differentiate between two distinct fracture types based on their underlying healing mechanisms and radiographic presentations. Accurate identification is critical for appropriate treatment planning, patient education, and predicting outcomes, directly impacting patient safety and the effectiveness of surgical intervention. Misclassification can lead to delayed or incorrect management, potentially compromising bone union and increasing the risk of complications. The OTSC must apply their knowledge of fracture biomechanics and healing biology within the established regulatory framework governing their practice. Correct approach analysis. The correct approach involves a comparative analysis of the fracture's radiographic appearance and the expected biological response based on the fracture's classification. For example, a transverse fracture in a healthy adult bone typically exhibits a clear fracture line with minimal displacement and is expected to heal through primary bone healing, direct osteonal remodeling, if rigidly fixed, or secondary bone healing, callus formation, if allowed some micromotion. In contrast, a comminuted fracture, characterized by multiple bone fragments, often involves significant soft tissue injury and a more complex healing process that may require extensive callus formation and a longer recovery period. The OTSC's role is to recognize these differences and communicate them effectively to the orthopedic surgeon, ensuring treatment aligns with the fracture's inherent healing potential and the patient's overall condition. This aligns with the OTSC's responsibility to provide accurate technical support and contribute to informed clinical decision-making, as mandated by professional practice standards and the certifying body's guidelines. Incorrect approaches analysis. One incorrect approach would be to solely rely on the visual appearance of the fracture without considering the underlying biomechanical forces and the expected healing cascade. For instance, classifying a fracture solely by its line pattern, e.g., transverse, oblique, without acknowledging the degree of comminution or displacement would be an incomplete assessment. This overlooks the fact that comminution significantly alters the healing environment and often necessitates different surgical approaches and post-operative management. Ethically, this failure to conduct a thorough assessment could be seen as a lapse in professional diligence. Another incorrect approach would be to assume all fractures heal identically, regardless of type or location. This ignores the well-established principles of bone healing, which vary based on factors like blood supply, mechanical stability, and the presence of infection or systemic disease. For example, a stress fracture, often a fatigue failure, heals differently than an acute traumatic fracture. A failure to recognize these distinctions would violate the principle of providing evidence-based care and could lead to inappropriate treatment recommendations, potentially contravening regulatory guidelines that emphasize competent practice. A further incorrect approach would be to prioritize patient comfort over accurate fracture classification when communicating findings. While patient well-being is paramount, the OTSC's primary responsibility in this context is to provide precise technical and diagnostic information to the surgeon. Downplaying or misrepresenting the severity or type of fracture to avoid causing patient anxiety would be a breach of professional integrity and could lead to suboptimal treatment decisions, violating ethical codes of conduct and potentially regulatory requirements for accurate reporting. Professional reasoning. Professionals should approach such scenarios by first meticulously reviewing the radiographic images, noting the fracture pattern, displacement, comminution, and any associated soft tissue injury. Concurrently, they must recall and apply their knowledge of bone healing biology, considering how the specific fracture characteristics influence the expected healing process, e.g., primary VS, secondary healing, callus formation, remodeling. This information should then be synthesized to arrive at the most accurate classification. Finally, this classification and its implications for treatment and prognosis should be clearly and accurately communicated to the supervising orthopedic surgeon, facilitating collaborative and informed patient care. This systematic process ensures adherence to professional standards and regulatory expectations for competent and ethical practice. Question 17. To address the challenge of ensuring precise surgical site identification for an upcoming orthopedic procedure, which of the following methods for confirming critical anatomical landmarks demonstrates the highest level of professional diligence and adherence to patient safety standards? Option A. Palpating and visually confirming the specific bony prominences and soft tissue structures that define the surgical target, cross-referencing with adjacent anatomical features to ensure accuracy. Option B. Using a single commonly referenced anatomical point without verifying its exact position or correlating it with other surrounding structures. Option C. Estimating the location of landmarks based on the patient's overall body habitus and general anatomical knowledge without direct palpation or visual confirmation. Option D. Relying on the patient's verbal confirmation of the general area, where they experience discomfort as the primary determinant of the surgical site. Correct answer is A. Palpating and visually confirming the specific bony prominences and soft tissue structures that define the surgical target, cross-referencing with adjacent anatomical features to ensure accuracy. Explanation. This scenario is professionally challenging because accurate identification of anatomical landmarks is fundamental to patient safety and surgical success. Errors in landmark identification can lead to incorrect surgical site marking, malpositioning of implants, or damage to surrounding structures, all of which have significant patient safety implications and can result in adverse events. The orthopedic technologist surgery, certified OTSC, role demands meticulous attention to detail and a thorough understanding of anatomy to prevent such errors. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols for anatomical landmark identification. This aligns with the core ethical principles of beneficence and non-maleficence, ensuring that the patient receives care that is both beneficial and avoids harm. Furthermore, it reflects a commitment to professional competence and the maintenance of high standards of care expected of a certified orthopedic technologist. Adherence to these principles is implicitly or explicitly required by the regulatory framework governing OTSC certification, which emphasizes safe and effective patient care. An incorrect approach that relies solely on patient self-reporting for landmark identification is professionally unacceptable. This fails to meet the standard of care by delegating a critical anatomical assessment to an individual who may lack the necessary anatomical knowledge or be experiencing pain or discomfort that impairs their judgment. This approach risks significant patient harm and violates the principle of professional responsibility to ensure accurate assessments. It also bypasses established protocols for surgical site marking, which are designed to mitigate such risks. Another incorrect approach that involves approximating landmarks based on general body shape rather than precise palpation and visual confirmation is also professionally unacceptable. This method is inherently imprecise and increases the likelihood of error, potentially leading to incorrect surgical planning or execution. It demonstrates a lack of diligence and a failure to apply the specialized knowledge and skills expected of an OTSC, thereby compromising patient safety and potentially violating regulatory expectations for accurate anatomical assessment. A third incorrect approach that relies on a single, non-validated reference point without cross-referencing with other anatomical structures is professionally unacceptable. This demonstrates a superficial understanding of anatomical relationships and a failure to employ a robust method for landmark verification. The complexity of human anatomy necessitates a multifaceted approach to ensure accuracy, and relying on a single, unconfirmed point introduces a high risk of misidentification and subsequent patient harm. This approach falls short of the expected professional standard for accurate anatomical assessment. The professional reasoning process for similar situations should involve a systematic approach. 1. Understand the specific surgical procedure and its anatomical requirements. 2. Identify all relevant anatomical landmarks for the planned intervention. 3. Employ palpation, visual inspection, and, where appropriate, imaging to confirm the precise location of each landmark. 4. Cross-reference multiple landmarks to ensure accuracy and rule out potential misidentification. 5. Document the identified landmarks and the method of confirmation. 6. Communicate any uncertainties or discrepancies to the surgical team immediately. 7. Always prioritize patient safety and adhere to established institutional protocols and regulatory guidelines. Question 18. Benchmark analysis indicates that an orthopedic technologist surgery certified OTSC is presented with a patient exhibiting a palpable mass in the proximal humerus, accompanied by radiographic evidence of a lytic lesion with ill-defined margins and periosteal reaction. The OTSC has reviewed the imaging and clinical notes. Which of the following represents the most appropriate immediate course of action for the OTSC? Option A. Document all clinical observations and imaging findings meticulously and present them to the supervising orthopedic surgeon for definitive diagnosis and management planning. Option B. Advise the patient that the lesion appears benign based on the radiographic appearance and no further immediate action is necessary beyond routine follow-up. Option C. Focus solely on the patient's subjective report of pain and recommend over-the-counter pain medication without further investigation of the imaging findings. Option D. Inform the patient that the imaging strongly suggests a malignant bone tumor requiring immediate surgical intervention. The correct answer is A. Document all clinical observations and imaging findings meticulously and present them to the supervising orthopedic surgeon for definitive diagnosis and management planning. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an orthopedic technologist surgery certified OTSC to differentiate between benign and malignant musculoskeletal tumors based on clinical presentation and diagnostic imaging, a task that has significant implications for patient prognosis and treatment planning. Misidentification can lead to delayed or inappropriate intervention, impacting patient outcomes and potentially violating professional standards of care. The OTSC must exercise careful judgment, recognizing the limitations of their role and the necessity of accurate reporting to the supervising physician. Correct approach analysis. The correct approach involves meticulously documenting all observed clinical signs and imaging findings, and then presenting this comprehensive information to the supervising orthopedic surgeon for definitive diagnosis and management. This aligns with the OTSC's scope of practice, which emphasizes technical skill and data collection rather than independent diagnosis. Regulatory frameworks for certified allied health professionals typically mandate that diagnostic interpretations and treatment decisions rest with licensed physicians. Ethical practice dictates that the OTSC acts as a vital member of the healthcare team, providing accurate and timely information to facilitate optimal patient care, thereby upholding the principle of beneficence and avoiding harm. Incorrect approaches analysis. One incorrect approach is to make a definitive statement about the tumor being benign or malignant based solely on imaging characteristics. This constitutes practicing medicine without a license, a direct violation of regulatory statutes governing healthcare professionals. It bypasses the established diagnostic hierarchy and usurps the authority of the physician, potentially leading to incorrect treatment and patient harm, a breach of the OTSC's ethical duty of care. Another incorrect approach is to dismiss concerning imaging findings as insignificant without thorough documentation and consultation. This failure to report potentially critical information can lead to delayed diagnosis of malignancy, directly contravening the OTSC's responsibility to contribute to patient safety and well-being. It represents a dereliction of duty and a failure to adhere to professional standards of vigilance and reporting. A third incorrect approach is to rely solely on patient self-reporting of symptoms without correlating it with objective clinical and imaging data. While patient history is crucial, it is not a substitute for objective assessment. This approach risks overlooking subtle but significant pathological indicators visible on imaging, potentially leading to underestimation of the tumor's nature and severity, and thus inadequate or delayed medical intervention. Professional reasoning. Professionals should employ a systematic approach. 1. Thoroughly assess the patient's clinical presentation, noting all signs and symptoms. 2. Meticulously review and document all relevant diagnostic imaging findings. 3. Correlate clinical and imaging data. 4. Present all documented findings and observations clearly and concisely to the supervising orthopedic surgeon. 5. Await the surgeon's definitive diagnosis and treatment plan before proceeding with any further actions beyond data collection and preparation for procedures. This process ensures adherence to scope of practice, regulatory compliance, and ethical patient care. Question 19. Quality control measures reveal a pattern of incomplete patient assessments regarding potential osteoporosis. A patient presents with a history of falls and a family history of hip fractures, but the orthopedic technologist's notes primarily focus on immediate musculoskeletal complaints without systematically documenting these critical risk factors or considering appropriate diagnostic pathways. Which of the following represents the most appropriate and professionally responsible course of action for the orthopedic technologist in this situation, adhering strictly to the regulatory framework for an orthopedic technologist surgery certified (OTSC)? Option A. Initiate a detailed review of the patient's medical history to systematically identify and document all known risk factors for osteoporosis and ensure that appropriate diagnostic imaging, such as a bone mineral density test, is considered and discussed with the supervising physician based on established clinical guidelines. Option B. Advise the patient to increase their calcium and vitamin D intake based on the reported family history, without further diagnostic investigation or physician consultation. Option C. Recommend over-the-counter pain relievers to manage the patient's symptoms and document that the patient has no visible signs of skeletal deformities, thus ruling out significant bone health concerns. Option D. Focus solely on managing the patient's immediate musculoskeletal pain, assuming that any underlying bone density issues will be addressed by the physician if they deem it necessary. The correct answer is A. Initiate a detailed review of the patient's medical history to systematically identify and document all known risk factors for osteoporosis and ensure that appropriate diagnostic imaging, such as a bone mineral density test, is considered and discussed with the supervising physician based on established clinical guidelines. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient presentation and the potential for misinterpretation of diagnostic findings related to osteoporosis. An orthopedic technologist must navigate the complexities of identifying risk factors, understanding diagnostic criteria, and recognizing appropriate treatment modalities within the strict confines of their scope of practice and the regulatory framework governing their certification. The challenge lies in ensuring that patient care aligns with established best practices and regulatory mandates, particularly when dealing with a condition that can have significant long-term implications for patient mobility and well-being. The quality control measure highlights a need for vigilance in ensuring consistent and accurate application of knowledge and skills. Correct approach analysis. The correct approach emphasizes a comprehensive assessment of the patient's medical history to identify established risk factors for osteoporosis, such as age, sex, family history, previous fractures, and lifestyle choices. It also involves understanding the role of diagnostic imaging, specifically bone mineral density (BMD) testing, as the primary diagnostic tool, and recognizing the indications for such testing based on established clinical guidelines. Furthermore, it requires knowledge of the general principles of osteoporosis management, including lifestyle modifications and pharmacological interventions, and understanding when to refer to a physician for definitive diagnosis and treatment planning. This approach represents best professional practice because it adheres to the established diagnostic and management pathways for osteoporosis, ensuring patient safety and optimal outcomes. It aligns with the regulatory framework by operating within the defined scope of practice for an orthopedic technologist surgery certified, OTSC, which includes patient assessment, data collection, and assisting in the care plan under physician supervision, rather than independently diagnosing or prescribing treatment. Incorrect approaches analysis. One incorrect approach involves solely relying on a patient's subjective report of bone pain without considering objective diagnostic measures or established risk factors. This is professionally unacceptable, as it bypasses the regulatory requirement for evidence-based assessment and could lead to delayed or incorrect management, potentially violating ethical obligations to provide competent care. Another incorrect approach is to independently recommend specific pharmacological treatments based on perceived symptoms. This directly infringes upon the physician's exclusive right to diagnose and prescribe, violating the regulatory framework that delineates the scope of practice for allied health professionals and could result in patient harm. A third incorrect approach might be to dismiss a patient's concerns about bone health due to a lack of visible physical deformities, ignoring the silent nature of osteoporosis and its significant risk factors. This demonstrates a failure to adhere to best practices in patient assessment and could lead to missed opportunities for early intervention, thereby failing to meet professional standards of care. Professional reasoning. Professionals in this role should employ a systematic decision-making process that begins with a thorough review of the patient's presenting information and medical history. This involves actively seeking out and documenting known risk factors for osteoporosis. Concurrently, they must be aware of the diagnostic modalities available and their indications, understanding when to facilitate or recommend their use under physician guidance. Crucially, they must recognize the boundaries of their scope of practice, understanding that diagnosis and treatment prescription are the purview of the physician. When faced with uncertainty or complex presentations, the professional reasoning process dictates consultation with the supervising physician or appropriate specialist to ensure the patient receives the highest standard of care, consistent with all applicable regulations and ethical guidelines. Question 20. Compliance review shows a patient presenting with moderate knee osteoarthritis, experiencing pain and stiffness that impacts daily activities. The Orthopaedic Technologist Surgery Certified OTSC is tasked with contributing to the patient's management plan. Which of the following approaches best aligns with current best practices and regulatory expectations for OTSC scope of practice in managing osteoarthritis? Option A. Recommending a personalized exercise program focusing on strengthening supporting muscles, patient education on joint protection techniques, and discussing non-pharmacological pain relief modalities like heat or ice. Option B. Prescribing high-dose opioid analgesics to immediately eliminate all pain and allow the patient to resume all previous activities without modification. Option C. Suggesting the patient ignore the pain and focus solely on mental well-being, as osteoarthritis is a degenerative condition with no effective management. Option D. Advocating for immediate arthroscopic surgery to debride the joint, irrespective of the patient's response to conservative measures. The correct answer is A. Recommending a personalized exercise program focusing on strengthening supporting muscles, patient education on joint protection techniques, and discussing non-pharmacological pain relief modalities like heat or ice. Explanation. Scenario analysis. This scenario presents a professional challenge in managing a patient with osteoarthritis (OA) by requiring the Orthopaedic Technologist Surgery Certified OTSC to critically evaluate different management strategies. The challenge lies in discerning the most appropriate, evidence-based, and patient-centered approach within the established regulatory framework for OTSC practice. This requires a deep understanding of OA pathophysiology and its management options, as well as the ethical and professional responsibilities of the technologist. The OTSC must consider not only the immediate clinical needs, but also the long-term implications for the patient's quality of life and adherence to treatment protocols, all while operating within the scope of their certification. Correct approach analysis. The correct approach emphasizes a comprehensive, multimodal management strategy that addresses the multifaceted nature of osteoarthritis. This aligns with best professional practice by prioritizing patient education, conservative interventions, and judicious use of pharmacological and surgical options as indicated. Regulatory frameworks for OTSC typically mandate adherence to evidence-based practice and patient-centered care. By focusing on lifestyle modifications, physical therapy, and pain management, the technologist is acting within their scope to optimize patient function and well-being, thereby upholding professional standards and ethical obligations to provide effective and appropriate care. This approach respects the patient's autonomy and promotes active participation in their management plan. Incorrect approaches analysis. An approach that solely relies on immediate pain relief through high-dose analgesics without addressing underlying biomechanical factors or lifestyle modifications fails to provide holistic care. This could lead to potential medication side effects, dependence, and a masking of progressive joint damage, which is contrary to the principles of long-term patient health and well-being. Ethically, this approach could be seen as a failure to provide comprehensive care and could violate guidelines that promote conservative management before more invasive or pharmacologically intensive interventions. An approach that immediately escalates to surgical intervention for all patients with OA, regardless of the severity of symptoms or failure of conservative measures, is also professionally unsound. This bypasses crucial steps in the management pathway and may expose patients to unnecessary surgical risks and complications. Regulatory guidelines for OTSC typically advocate for a stepwise approach to treatment, reserving surgery for cases where conservative options have been exhausted and the patient's quality of life is significantly impaired. This approach could be considered a deviation from established clinical pathways and potentially an overreach of appropriate intervention. An approach that dismisses patient-reported pain and functional limitations as solely psychological, without a thorough clinical assessment and consideration of the pathophysiology of OA, is a significant ethical and professional failing. This demonstrates a lack of empathy and a failure to adhere to the principles of patient-centered care. It neglects the direct impact of OA on a patient's life and could lead to delayed or inadequate treatment, potentially exacerbating the condition. Regulatory bodies for healthcare professionals emphasize the importance of respecting patient experience and conducting thorough assessments. Professional reasoning. Professionals in this role should adopt a systematic decision-making process that begins with a thorough patient assessment, including a detailed history, physical examination, and review of diagnostic imaging. This should be followed by an evidence-based evaluation of available management options, considering the patient's individual circumstances, preferences, and the current understanding of OA pathophysiology. Collaboration with the orthopedic surgeon and other healthcare providers is crucial to develop a shared care plan. Continuous patient education and regular follow-up are essential to monitor progress, adjust treatment as needed, and ensure adherence to the management strategy. This iterative process, grounded in ethical principles and regulatory compliance, ensures optimal patient outcomes.